Recorded. There you go. This session is being recorded so that we can share our program with anyone who isn't able to join us today. So some context. Last year, my office hosted the Older Adult Summit at the Nepean Sportsplex. Although that summit was a great success, there was one area of interest that we couldn't include in our program that day, which was the subject of elder abuse. That's why we're here today, and I'm very grateful to the partners and subject matter experts who have joined us to share their expertise with you. Another question to my audience. Bonnie, can you see that I have a title slide of my presentation up? Fantastic, great. So today we're going to be hearing presentations from Connected Canadians, from the Ontario Caregiver Association, from Elder Abuse Prevention Ontario, from the Ottawa Police Service, and from the Canadian Anti-Fraud Centre. We also have a special guest speaker and author, Savvy Duffy. Finally, I'd like to thank my partner organizations. From the Nepean Rideau Osgoode Community Resource Centre, Brad Spooner is here to provide opening remarks. And from the Council on Aging of Ottawa, Bonnie Schroeder will act as our moderator for our two question and answer segments. Before we begin, I thought I'd just provide a little bit of detail on how today's event will proceed. The event is scheduled to go until 3 p.m., but this Zoom meeting won't stop broadcasting if we run over time. My co-host, Brad Spooner, is going to lead us off with some opening remarks. Then after those opening remarks, we're going to have our first three short presentations. Following those presentations, we're going to hand it over to Bonnie for the first question and answer period, where the audience can ask questions of any of those first three presenters. After that, we're going to have our guest speaker, and then our final two presentations. We'll then have Bonnie lead our second Q&A period. For the question and answer segments, our audience can participate in two ways, and we ask that you hold your questions until we get to those segments. You can either type your questions into the chat, or you can click on the raise hand Zoom function. My office team and our moderator will sort through your questions, and we will try to get to as many of them as possible. For any questions that we don't get to, we'll try to send them off to the right person to answer. For anyone who has a question that they would prefer remain anonymous, our recommendation is that you use the chat function to write down your question. And rather than send the question to all, you can click on a drop-down menu and send the question directly to our moderator, Bonnie Schroeder. With that said, thank you again for being here. I'm now going to hand it over to my co-host. Please welcome the program manager. I just want to stop my presentation there. Please welcome the program manager from the Nepean Rideau Osgoode Community Resource Centre, Mr. Brad Spooner.
No sound.
Okay, can you hear me now?
Yes, we can.
Perfect. Thank you everybody for joining. I see there's quite a few on the screen that I can see for sure. I recognize a few familiar faces anyways, and as I say, it's great for me to provide a little bit of insight, albeit very short, as per my instructions to remain short. And but again, thank you for joining us this afternoon for the Elder Abuse Awareness and Prevention Seminar. I, of course, would like to recognize Councillor Sean Devine and his assistant, Megan Wood, for providing me with the opportunity to join you. As Sean mentioned, my name is Brad Spooner. I'm the manager at NROC, and I was responsible for the supervision of the now closed Elder Abuse Response and Referral Service. That particular service in the city of Ottawa was in place for approximately 15 years up till May of 2023, when we were informed by the province that there would no longer be funding provided to deliver that particular service in Ottawa. The unfortunate thing about that is that folks who wanted to get in touch with somebody to discuss their issues related to this, would have to do so by connecting with Carrefour and Cornwall, which we obviously would probably mutually agree that that's a very difficult sort of approach, considering the geographic distance between Cornwall and the city of Ottawa. So today you're going to hear from some experts on the topic of elder abuse, and they'll share some insightful information on the topic. What I will ask you to think about right now is, what is the difference between child abuse and elder abuse besides the age demographic? This is just a question to think about. What I do know is that there's several factors that are similar: physical, emotional, psychological, sexual, neglect, or a complexity of financial abuse combined together. So let's ask ourselves the question, why does child abuse have a mandatory reporting process and elder abuse does not? I will say, though, that there is mandatory reporting in long-term care homes and retirement homes. Older adults are equally susceptible to the multiple forms of abuse, yet there is no mandate to report elder abuse in the general public. However, I will say there are many forms of abuse that are actually offenses and can be reported as a single offense, whereas I can say with certainty that there's typically more than one form of abuse that is actually, that makes up an abusive situation. It isn't just one. It usually is complex in that there's multiple forms. Anyways, I want to say that certainly enjoy the session. You will get some insightful information, and I will be back for some closing remarks at the end. Thank you.
Thank you very much, Brad. Very grateful to have NROC's participation and insight here. So now we are going to, our first presentation today is from Connected Canadian, a national organization that promotes digital literacy skills for older adults. Please welcome the General Manager of Connected Canadians, Ken Roy. Hello, Ken.
Hi there, everyone. Great to be here. Thank you so much to the City of Ottawa, Ward 9, for having Connected Canadians here. It's so great to see some familiar faces, as Brad mentioned, and some new faces. Oh, yep, I see that Sean is sharing my slide deck for me here. So yeah, I'm the General Manager at Connected Canadians. You can go ahead to the next slide there, Sean. A little bit about who we are at Connected Canadians. We're proud to call ourselves Canada's leading digital inclusion charity, focused on making sure folks 50 and up across the country have free help with technology training and support. And this is so important for so many different reasons, but the elder abuse side of technology, where there's so many cyber threats and so many bad actors out there looking to take advantage of people who are often inexperienced with technology. So our goal is to connect seniors across the country and older adults across the country with knowledge that helps them be more confident to be able to spot signs of cyber threats, and also just to feel more comfortable with connecting with technology and using that to improve their quality of life. There's a lot of different organizations we have logos on this slide with, which kind of represent many of our partners. We've worked closely with NROC, we've worked closely with the Elder Abuse Prevention Network Ontario, and many, many other organizations across the country. Our next slide here is just a quick little, that video might not play because it's a PDF, Sean, and that's okay. I wanted to show it a compilation of testimonials, but we can move on because I'm not sure the video will play there. So I want to talk a little bit about the different things that we do to help make older adults feel comfortable using technology, but also feel safe navigating the digital world. Our main charitable activity at Connected Canadians is providing one-on-one support. We have what we call a tech helpline, that allows anybody 50 and up across Canada to call us locally here in Ottawa or toll free from across the country, email us, go on our website and book these one-on-one sessions. And what we have is a team of coordinators who, pick up the phone and make sure that they, find out where you're at with technology, what kind of help you need, what kind of device you need help with. And there's no limit to the amount of help you can get. We will work hard to pair you with the right trained and certified technology mentor who can help you learn at your own pace. These sessions can be held both virtually using screen sharing tools like Zoom, and also in person at public locations like coffee shops or community resource centers or local libraries. And like I said, there's no limit. It could be learning a device for the new device for the first time, or even something more complex like looking to build a blog online or create a website, and anything in between. Sean, if you could. We've also worked with healthcare organizations throughout the pandemic. They had to help a lot of patients learn how to use virtual platforms like Zoom or Microsoft Teams, or just to access, virtual health portals. So we put a lot of work into making sure we can pair those folks one-on-one to help them access virtual care. Next slide. We also offer digital literacy workshops. We've got 22 different workshop topics, and many of them do cover a variety of different, elder abuse adjacent topics like recognizing phishing scams online and how to prevent yourself safe, or prevent those kind of attacks from happening to you, or how to report phishing attempts if you identify them. We also teach on how you do online shopping and online banking safely and securely, and how to recognize phishing attempts when using those kind of tools. There's a whole host of different workshops that we offer, either virtually or in person, where we have our workshop facilitators located. And there are customized handouts that you can print off, or that we print off for you, which help you kind of summarize the workshop topics that we cover. We do virtual art tours through the partnership with the National Gallery of Canada, exploring the art exhibits that they have online and pairing folks one-on-one with our mentors to explore their website and the different exhibits they have there. We offer employer-sponsored volunteering to corporate organizations like Adobe, Best Buy, and Deloitte, and train their wonderful employees on how to work directly with our older clients and help them learn new technologies and devices at their own pace. We also recognize that a barrier to using technology can often be access to technology. So we work hard to work with partners to help them build device libraries, so that folks who don't have access to devices can finally have access to a device and learn how to use it safely and securely. And you can skip that there, Sean. So we work with a lot of different corporate organizations on a lot of initiatives. Recently, TD sponsored Connected Canadians to create a comprehensive workshop curriculum to help older adults learn how to do online banking tasks. So we've got that in a workshop format. We've certified and trained some of our most trusted mentors to deliver that content in a one-on-one setting and help seniors learn how to do online banking. And we have comprehensive video and document, like PDF print-off document resources, to help people know how to do online banking safely. Lastly, we recognize that there's a lot of organizations out there who are senior focused and have a lot of volunteers or staff who are working with seniors directly. So we've developed different training modules to help older adults learn, or help those volunteers and staff know how to help older adults learn at their own pace, and to do that in a comfortable environment. So we've put a lot of work into training thousands of staff and volunteers across Canada at public libraries, major hospitals, even Rogers Communications. And we are currently developing our own cyber safety first aid training and certification program, which is designed for anybody who wants to learn how to keep themselves safe, how to help others stay safe online and avoid different cyber threats. And that certification is going to be video-based modules so people can learn at their own pace and get a certification from Connected Canadians. I mentioned a little bit about Rogers. We work with them in 2022 to train 2,000 of their technicians who install cable and internet services on how to help their clients, feel more engaged when they're receiving that technology, how to feel more safe when using it. And we've had overwhelmingly positive feedback from that. And it's just a testament to the way that we train our technology mentors and externally many mentors at different organizations who are helping older adults with technology. A little bit about our trained mentors. Our technology mentors go through a very rigorous onboarding process to make sure our clients feel safe and can have the best possible experience. We do preliminary virtual interviews with our volunteers. We do vulnerable sector checks. We do professional reference checks, government issued photo ID, and hours of online training. And they even have to pass a role play session with one of our test drive senior volunteers. So what can Connected Canadians help with? Pretty much anything technology related, as long as we're helping to make sure our clients are building their feeling of security when using technology and building their independence. So, using email, learning to fix a printer error, how to transfer files. There's pretty much anything that you can dream of, we're able to help with. Some of the things we're not able to help with, things that would normally be contracted out to paid professionals, like building a website for people, or creating a legal document for somebody, or going out and buying technology for a client. So those are some of the things that Connected Canadians mentors are not able to help with. Clients' personal information is incredibly important to us. When people reach out to Connected Canadians, we do ask for some pieces of personal information, like phone number, emergency contact numbers, email address, year of birth, to help us with reporting and getting more funding, and finding out how people heard about us. And we ask for people to consent to receive future communications from Connected Canadians about different free programming that they can access. So yeah, you can keep going there, Sean. Lastly, I want to mention we do have a waiver process for folks who are receiving free support from Connected Canadians. We have an individual click-through liability waiver, and our coordinator will walk folks through that and all the information it contains to help people understand and feel more safe accessing our free services. All Connected Canadians clients do have to complete that waiver prior to receiving any sessions from Connected Canadians. And lastly, I want to mention our secondary mandate at Connected Canadians. Many of our mentors at Connected Canadians are newcomers to Canada who really benefit from meaningful interactions with older Canadians. And so our mentors, they collectively speak over 26 languages. And a lot of our seniors really feel a sense of pride and connection in helping welcome those newcomers into the community. So I did want to mention that that's sort of our secondary mandate at Connected Canadians, is helping those folks have meaningful opportunities working with our clients. And lastly, I just want to mention our funding model and vision. We work hard to get government and community foundation grants to make sure that we can keep operating our free one-on-one service. And we also work with many partners offering, workshops or other different revenue generating services that, again, help us bring in funds to keep offering that free support. We want to make sure anybody at 50 and up across the country can pick up the phone and call us if they have experienced any kind of digital, financial, or abuse in any kind of way related to technology, or if they just need help learning any kind of device, and they can get that free, reliable support from Connected Canadians. And there's a little bit of next steps. I'm going to put this information in the chat so that everybody can see our contact information and feel comfortable reaching out to us at any time. I just want to thank everyone here for hosting Connected Canadians. Thank you so much to the City of Ottawa, and looking forward to answering some questions as well.
All right, well, thank you very much, Ken. Thank you for taking us through all of the diverse services and programs that Connected Canadian offers, and I'm sure everyone would agree that having that kind of tool in the toolbox, providing that kind of digital literacy is extremely useful, especially when so much fraud takes place online these days. So Ken, thank you very much. I hope you stick around for our first Q&A session, which will begin very soon. So I'm going to now get our next presentation deck up. So give me 1 second, everyone, and then I'll introduce our next guest. All right, so next up we have a presentation from the Ontario Caregiver Association, who are going to talk to us about caregiver burnout and mitigating elder abuse. Please welcome from the Ontario Caregiver Association, Regional Team Leader, Anne-Marie Boutiette. So welcome, Anne-Marie, and I'm going to hand the floor over to you.
Thank you very much, Sean. Thank you so much for inviting me today to tell you a little bit more about the Ontario Caregiver Organization and to give a presentation. My name is Anne-Marie Boutiette. As Sean mentioned, I'm the OCO Regional Lead for Eastern Ontario, as well as Francophone communities across the province. And today I'm going to look at the risk of elder abuse in the context of caregiving, specifically from a preventative lens. But before I do that, just wanted to tell you a little bit more about the OCO. So basically, we exist to improve the lives of Ontario caregivers, regardless of age, diagnosis of the care recipient, or where they live anywhere in Ontario. We were founded in 2019. We're a not-for-profit organization funded primarily by the Ministry of Health. Our work consists in providing direct services and programs to the approximately 4 million caregivers across the province, but we also work hand in hand with stakeholders in the healthcare sector to ensure that caregivers are identified, included, and supported in the important work that they do. We view caregivers as key partners in Ontario's healthcare system. Next slide, please. So when we look at data that the OCO gathered last year regarding Ontario caregivers, we can see that the top 3 health conditions, so in that middle section in the teal there, that caregivers are supporting are related to aging. We also see that we expect to see 6.5 million caregivers by 2030, so like over 50% more than what we have today. And this is due in large part to the aging population and to their increasing care needs. But more importantly, kind of the 2 sections on the right there, we see that with the numbers that we have today, we're already seeing an increasingly exhausted, burnt out caregiver population who's not coping well with the demands of caregiving. So where does caregiving and elder abuse intersect? Well, research in the field of public health has drawn a strong correlation between the risk of elder abuse by a caregiver and the caregiver's burden and mental health. So in other words, the higher the burden of care and or the worse the caregiver's mental health, the higher the risk of abusive behavior toward the care recipient. It's important to note, however, that most people don't intend to become abusive or neglectful. They may feel uncomfortable or overwhelmed with the changing roles in their family, especially if the older adult now relies on them. And some family members just may not know how to provide the care or the help that their care recipient needs. They may not understand the nature of the health concern or how it affects the older adult's abilities or behavior. They might also have a lot of competing demands, such as a career or a young family, and just have difficulty reconciling all of these things, which increases the stress. When we look at data that we've gathered over the last couple of years, we've seen it definitely an increase in the stressors and things that, you can go to the next slide, Sean, things that impact our caregivers. And, you know, you see 73% of them, 75%, like they're at their breaking point. They don't think they're going to be able to handle anymore. Half of them are telling us they need a break from caregiving duties, that they're feeling lonely or isolated. And almost 80% say that they can't take any more on than what they already have. Next slide, please. Stress is a normal part of life. And in the case of positive stress, it can even be empowering and motivating. But negative stress, which is when the demands that are placed on us seem greater than what we can manage, it's a different story. And if it's not managed properly, it can impact caregivers' mental and physical well-being. There's a lot of factors that contribute to negative stress, ranging from things that are out of our control, like, for example, working in a system. If you're caring for somebody, you're dealing every day with the healthcare system or social services, or staff shortages in those sectors as well, right? And wait lists, like those are things that are outside of your control. But there are things that are within your control, like the expectations that we place on ourselves and the ways that we prioritize our own wellness. Next slide. So caregiving can be emotionally, physically, and mentally demanding. If you feel anxious and overwhelmed by your caregiving responsibilities, you're not alone. And as we just saw, burnout can be caused by several factors that are beyond your control. And while OCO is working to tackle some of these systemic issues, I'm not going to really address those today, but instead we'll review some of the strategies that you can use to help you cope with some of the stresses of caregiving that are within your control and that can hopefully help decrease the risk of elder abuse. Next slide. So mental wellness and stress exist on a continuum. Correspondingly, so do the measures that we can take to regulate ourselves. So when we're feeling well or able to manage the stress that we're faced with, we find ourselves at the top of this continuum. But as things get more overwhelming, we start to slide down until we reach a crisis point. If you find yourself in the upper sections where you're still able to cope, that's the time for what's called active prevention. We know that caregiving is a stressful job and that anything can happen at any time. So active prevention helps us to stay healthy, both mentally and physically, so we can better respond to periods of higher stress without sliding into burnout. That's the key. So active prevention includes, the things that you see on this list: getting good sleep, eating well, getting exercise. But if there's one that I would recommend prioritizing, especially if caregiving is something that you're facing currently or in your very near future, is to build yourself a support network. Sharing the load is probably the most practical way to lessen the caregiving burden and then therefore, minimizing the stress. But also, self-care, self-compassion, and building your resilience are also very important ways to engage in active prevention. Next slide. Creating a wellness wheel, for example, is an activity that can support you in maintaining balance in your life. Often when a caregiver has time for themselves, for self-care, they don't know what to do. So taking the time to come up with a list like this and completing this activity can help you have some ideas in your back pocket for ways that you can nourish yourself in all of these different categories when you need them. Next slide. And then we talk about self-compassion. Really, it's about treating yourself with the same kind of kindness, gentleness, and encouragement that you would to a dear friend or a loved one. So really, self-compassion truly is one of those things that we are in complete control of. It's easy to fall into a mindset of negative self-talk, especially when you're carrying the weight of many caregiving and other responsibilities. And when I speak to caregivers, I often speak to them, then they tell me that they don't feel like they're doing enough or that they've made the wrong decisions for the people that they care for. The way that you speak to yourself is one aspect that you have control over. It takes practice, but shifting from negative frame of mind to a more positive one is so important to build self-compassion. So for example, instead of saying I should be more on top of things, try saying I'm doing my best and my best is enough. I'm resilient and I can handle the challenges that come my way. Or if you're having a bad day, acknowledge, yeah, today's a really bad day. Doesn't mean that I'm a bad person or that I'm not doing a good job. It's just a bad day. And tomorrow we can start over and have another opportunity to turn things around. It's also very impactful and important for you to be able to identify your caregiving strengths and then draw on them to shape your caregiving and build resilience. Family caregivers can sometimes feel swallowed up by the ongoing demands of the caregiving role and responsibilities. But with reflection and focus on the strengths and capabilities that you bring to your role, you can take greater control over your experiences, feel more competent, and enhance your own well-being. Maybe your strength is problem solving or your sense of humor, right? So how can you use that to turn things around when you're in a difficult situation? Next slide. Oh, did I skip one? Is there another one before that? No? There should be one that looks like the sliding
I'll see if
scale.
I'll see if I can go back.
That's okay. So if you remember the scale at the bottom was where you're in crisis. If you find yourself lower on the spectrum of stress or clearly are in burnout, we do encourage folks to seek out community supports or even think about, doing some emergency planning or building a backup plan. And we have tools and resources to support this at OCO. It's never too late to reach out for help. So, call your, if you are really feeling very badly, you can call 988, the Crisis Services Canada line. Elder Abuse Ontario is there to support you. Your primary care provider can help, Telehealth Ontario, 911, and so on. Stress is a normal everyday experience, but prolonged exposure to negative stress can lead to burnout. And as a caregiver, you are definitely at high risk of experiencing burnout. So if you display any of the warning signs of burnout, it's time to get more support. Talk to your doctor, healthcare professional, a family member, a friend, join a support group, or seek support from a mental health professional to help reduce your level of distress before you become a patient yourself. That's what we really are trying to avoid here. And also, that at the same time, lessen the risk of elder abuse. And some caregivers will experience these symptoms at different stages in their caregiving journey. And oftentimes, unfortunately, these feelings start to become normalized until people don't notice them anymore. But the toll is still being taken on your physical and mental health. So even if you think that you've got it covered, it's really important to keep that awareness, especially on physical symptoms. You might think that you're doing well, but maybe that niggling stomach issue that you're having, or those headaches that just can't go away, that's your body saying, you know what, you need to look at things because something's not right. Next slide. So these are some of the ways in which OCO can directly support you as a caregiver, and we encourage all caregivers to explore our online portal, to reach out if you have any questions or are feeling overwhelmed with the responsibilities of caregiving. Next slide. You don't have to do this alone, and by reaching out for help and managing your own mental health, you can help decrease the risk of elder abuse. So that's the end of my presentation. Thank you very much. I'll be available for the Q&A to answer your questions. Please consider subscribing to our newsletters to stay informed about upcoming events and webinars or other activities, and to have access to the latest resources that the OCO provides to support caregivers in Ontario. Thanks.
All right, thank you very much, Anne-Marie. I'm sure the audience can all see a correlation between better support for caregivers and lower rates of elder abuse. And in terms of building a support network for caregivers, I heard you mention that. The work that you and your organization do is an important component of that broad support. So thank you for that. Before we go on, I just want to welcome our third satellite host, the Trend Arlington Community Association. I hope that our 3 satellite stations can see and hear everything. So we have one more presentation in the first half of today's event before we go on to our first Q&A session. This next presentation is from Elder Abuse Prevention Ontario, which is a recognized leader in elder abuse across our province. From the Elder Abuse Prevention Ontario, please welcome their CEO, Marta Hyatt.
Thank you, Sean, and thank you for inviting our organization to speak at this event. 10 minutes is not a lot to cover over 30 years of work, but we will try. I'm joined today by Sheila Schuline, who will be on hand as well to answer some of the questions that arise during the Q&A. So very briefly, and Sean, if you could just advance the next slide.
Oh, sorry, I hit the wrong button. Give me 1 second. I'll make sure I got it right. There we go.
Okay, so in terms of the land acknowledgement, I trust that it was already done, and I apologize for joining a little bit late. So next slide, please. So just a little bit in terms of what I would like to cover. And as I said, 10 minutes isn't a lot, but I'll try and speak fast and just cover off some of the highlights. This deck, I believe, will be shared with participants so that, as well as, I guess, the recording. So there'll be some information embedded in there as well. Next slide, please. So as we know, the population of the world is definitely changing. The older adult group that we engage with and are here to support is growing at an unprecedented rate. It is, in fact, the fastest growing demographic in Canada. And rather than be reactive, everything that our organization does is really through that preventative lens. So preventing abuse, helping mitigate some of the harm and risk that comes. And we are so honored to be able to work with many of the callers or the participants in this presentation today as well, helping us keep older adults safe from harm. There are more people over the age of 65 than there are under the age of 15. That has all kinds of consequences there. And so again, we're approaching all this through that preventative lens, but also encouraging our funders and government at all jurisdictions to be more proactive in their approaches, whether through healthcare planning, resources in communities, or just, being there to help with the kind of funding that each of us would require. Next slide, please. As we age, there is an expectation that older persons have rights. These are human rights, and that entails a right to life, liberty, and security. And if we are capable, have the right to make our own decisions. They may not necessarily be the right decisions, but we have the right to make them and live with the consequences. Choose what is best for ourselves. Expect services that will be there within community so that we can age in place and independently within our own homes. That we have control over our destiny, our decisions. That we can preserve and maintain the quality of life and socioeconomic status that we're used to. They were able to practice diverse cultural customs, language differences, and celebrate different religious beliefs and practices. Next slide, please. When those rights are not adhered to or someone tramples over them, then that constitutes a violation of human rights and leads to abuse. Our organization envisions an Ontario where all seniors are free from ageism and abuse, where human rights are advanced, protected, and respected. And we purposely bolded that the sentence around the ageism and abuse, because ageism is at the core of why abuse happens. It's how we perceive older adults, how we treat them, and in fact, how some of the care is administered to support those populations. Next slide, please. We are funded by the Ontario government through the Ministry of Seniors and Accessibility. A little bit of a background in terms of our organization. So we've been around since 1989. In 2002, when the Ontario government introduced the strategy to combat elder abuse, our priorities, our focus, and our mandate was more clearly defined. The organization was founded by Dr. Elizabeth Podniaks, which I'm sure many of you are familiar with her. She passed away in early February of last year, and we celebrate her contributions by doing the best that we can to steward the organization that she started. She stood in front of the United Nations and had June 15th declared World Elder Abuse Awareness Day. It is a day that we celebrate annually, and for us, it's like the Super Bowl of events. But in fact, every day for our staff, a modest staff of 8 that World Elder Abuse Awareness Day is every day. Next slide, please. Those priorities that I mentioned in the strategy are really to deliver public education and raise awareness of the issue, to train frontline service providers and professionals that in the course of their daily practice, they engage with older populations, to be able to recognize what those signs are of abuse and how to effectively and safely respond. And finally, we're involved with the coordination of community services. So we will draw on subject matter experts, for example, invite them to participate in our monthly webinars and deliver some of the information that people are so wanting to learn about to help inform their work when they're dealing with older adults. Next slide, please. So I mentioned World Elder Abuse Awareness Day. This year, the tagline is "Be Bold and Age with Attitude." And because of the conflagration around the political things that are happening on both sides of the border, we have now added a Canadian maple leaf into the O of World Elder Abuse Awareness. Next slide, please. This is a year at a glance. Last year, just as I mentioned, overview of this, and you'll be able to find this on our website. But our staff of 8 were able to engage with over 40,000 individuals. That means doing case consults, that means delivering trainings, webinars, resource development for specific sectors. You name it, we're doing it. And many of you are our community partners in that effort. So thank you so very much for standing with us. Next slide, please. Again, none of this is possible unless we work in partnership. So we respect the boundaries of various sectors. We also recognize the subject matter experts in particular things that are not our forte, and we will make those connections again to bring more education and awareness, but also to augment or enhance the services that, for example, Ontario Caregivers will provide. Connected Canadians are, 2 perfect examples that we have an ongoing relationship and support each other in the work that we're doing. Just a quick overview in the next couple of slides. So though we are provincially funded and we reside in Ontario, our reach now has become global. We are one of the founders of the Canadian Coalition Against Ageism. And as I mentioned, ageism is at the core of why abuse happens. That coalition now represents almost 10 million older adults across Canada. We have been called upon to testify to the standing committees of the federal government, whether on social justice, speaking to abuse and harm, looking to support private members' bills to change the language in the criminal code, for example, that specifically names elder abuse as an issue. We belong to the Global Alliance for the Rights of Older Persons, and my colleagues are currently in Geneva speaking and intervening at the Human Rights Council 58th session, calling for the declaration of a UN convention that specifically addresses the rights of older persons. We have conventions for children, for women, for Indigenous populations, for the disabled community, but we have nothing that specifically provides a legally binding instrument to advocate on behalf of older persons. Canada is still sitting on the fence on this one, and we're having a hard time understanding why. Next slide, please. I mentioned the coalition. So periodically we will do more public-facing webinars on broader topics. Because we are the founders within the Canadian Coalition, we will on an annual basis provide a webinar that has over 800 people in attendance on this webinar to learn more about this UN convention. As I mentioned, our colleagues are in Geneva right now, so as soon as they return and are able to provide a little bit more comprehensive updates on what the progress has been, we will be advertising this webinar, and I would invite all of you to join in and learn what is being done. Next slide, please. Some of our provincial partnerships, some of you are on the call here, but again, we have a broad reach and people no longer just treat us as a provincial agency, but we are being called upon to pan-Canadian research projects, advocacy initiatives, as well as at the global level as well. Next slide, please. I have a host of slides, so maybe just kind of drive through these. So part of the partnership that we have is with the elder abuse prevention networks across Ontario. Just prior to COVID, we had 57 networks. When COVID hit, not only was our funding cut, we lost 3 staff positions, but we also lost a substantive number of our elder abuse networks. These are volunteer committees that are spread across the province. They are local committees of various people from various walks of life, or just concerned citizens or seniors themselves that want to make a change in how elder abuse is being tackled within their own communities. We support these communities by building capacity, by providing knowledge, hosting learning pods. There's a host of things that we will do to support these networks. And I'm pleased to say that over the course of the last 2 years, we've been able to build that up to almost 45 networks. Next slide, please. Again, these are all volunteer committees, and a lot of these individuals are doing this work off the side of their desk. We feel it's appropriate that all levels of government across all jurisdictions should be supporting the infrastructure for these networks to continue to do their good work in community. With the Canadian Network for Prevention of Elder Abuse, which is sort of our mothership, all provinces and territories are represented on this committee and on the board, but we created a roadmap of what it would mean to start an elder abuse prevention network at the local level. I would invite you to visit this website and learn a little bit more of how you can support our work in community. Next slide, please. One of the things that we're really very privileged to be part of is that we have always been advocating for diverse and different populations across the province to be included in these networks as well. There's no point having a committee around elder abuse prevention when there are no seniors' voices represented. Equally so, the Indigenous populations across Ontario are experiencing an inordinate number of instances of abuse, of financial exploitation. So about 2 years ago, we did an outreach to community, to leadership, to the tribal councils, to see if there was an opportunity for us to collaborate, to learn from each other, how best we can safeguard and support Indigenous populations. I'm so privileged to be part of this. I've taken this on as a personal file, but over the course of last summer, I was doing road trips around the North Shore of Superior. I met with 7 First Nations communities, each of which now are interested in collaborating with us and starting local either situation tables or elder abuse prevention networks. Oaks is one of those networks, and it is Indigenous led, and the individual responsible for this as chair has now interacted with over 6,000 Indigenous persons across the province of Ontario. Next slide, please. So the next couple of slides really talk about, what is elder abuse. So in the interest of time, I will just direct you to visit our website, but this is where you'll find definitions, all kinds of resources, all kinds of materials to help inform your knowledge about what abuse is, what the forms are that it takes, and what people can do individually to safeguard themselves or to assist others within your family or circle of friends that may be experiencing or at risk of abuse. Sean, if we can just jump through the next couple of slides. The prevalence, again, we can talk about this, but we know that elder abuse is underreported. There are various reasons why people will not report. For the most part, 93% of seniors live in community. When things happen behind closed doors, it's very difficult for others to note that something is wrong, something is off. How do we help? Only 7% of the population live in long-term care or retirement home congregate living settings, and that is where the most amount of press has given coverage, but there's so much more happening in community. As was mentioned, reporting is limited in terms of mandatory reporting to those congregate living settings. There is no bylaw, there is no law or rule that requires community reporting, but that doesn't mean that we can't do something to help intervene and advocate for the older person in a more social setting. It is important that whenever we do engage with older adults, that we have their consent to act on their behalf. Because perpetrators of these abuses are typically family members, people within trusted relationships, we forget that, you know, in the interest of wanting to do the good thing to support the senior, we may be putting them at further harm or risk. So the first question we always ask people is, I notice that things are a little bit off. I haven't seen you for a while. Are you okay? Is there anything you'd like to share with me? You open up that dialogue with a very simple statement, but it lets the older adult know that somebody's caring, somebody's listening, and somebody is potentially the person they could go to reach out for additional support or help. Next slides, please. So it is about that power imbalance. The abuser stands to gain something. The older adult will most definitely be losing something. And so it is really about recreating that balance. I mentioned it can happen in any environment to anyone, so we have to be alert to what those warning signs are and what situations we can or cannot intervene in. Maybe we can skip over the next couple of slides. We talked about ageism. Yeah, these next few slides, Sean, we can probably skip over because they're available on our website. Oh, this is an important one. So while we know the typical forms of elder abuse, there is one additional one that we have brought to the forefront, and we work with OATH and other shelters to bring attention to the fact that older women are experiencing abuse, intimate partner violence at an unprecedented rate. And so this gender-based violence that we are hearing about in the news or reading about in the media, this is very much an important issue. So last year, in November, when the Ministry of Community and Social Services put out a call, we responded with several of our Elder Abuse Prevention Network partners to engage in putting together a proposal where we would start to leverage the strengths and knowledge of both the Violence Against Women coordinating committees and the Elder Abuse Prevention Networks to try and find ways where we have common ground, where we can support each other, and then where we need to stay in our own lane. So we're yet to hear about the impact of that proposal, whether it will be awarded. As government was in caretaker mode during the election process, everything stopped. So we're hoping that any day now we should be hearing about this. If we are in fact successful, we will certainly come back to you and let you know what that means for community. I think if we jump towards the end about the resources piece here, so the support. So again, we talked about that preventing seniors abuse is a shared responsibility. No matter who you are, no matter which community you find yourself in, you have a part to play in this. But in order for that part to be effective, we need to be well informed, which is where that education piece comes in, visiting our website, subscribing to our newsletter, watching some of our webinars. These are all tools at your disposal. They are free of charge, but the more informed we are, the better we are able to safeguard ourselves and those within our circle of trust. We provide guiding principles in terms of how to respond to elder abuse. There is a critical path on the Elder Abuse Prevention Guide. I believe it's the next slide. It is mirrored on the REACT model from British Columbia that was applied in Indigenous communities. It is extremely effective, and it provides you with a critical path of this is what happens, this is what I can do. If this happens or doesn't happen, then I move to. It's a very visual, straightforward map in terms of how to react. Again, starting the conversation is the most critical piece. This is that olive branch that we can extend to those that we feel are at risk or experiencing abuse, to let them know that we're here for them. We're able to communicate whatever concerns, and if they give consent to do so, that we can intervene and advocate on their behalf. So I mentioned the consultations. So we do not case manage, but we do have case consultations that we offer to all our callers. People reach out to us, whether through the website, through emails, or actually by phone. We have staff dedicated to have those conversations. These are not 3-minute conversations. These are essentially a touch point for people to reach out and say, this is happening. What do I do next? So we will help those individuals navigate to the best resources that would help their situation in particular. It could be legal, it could be a healthcare provider. We help navigate that traffic. As well, the back end for our database is the 211 service in Ontario, which I hope many of you will frequent. But 211 is really that INR piece and provides local points of contact and programs and services across Ontario. It is now a national service, so if people are living in British Columbia, are concerned about someone in Ontario, contacting 211 is the mechanism to use, and the connections will be made to support the individual caller. Next slide, please. One of the last pieces I'd like to talk about is that we are involved in a research project right now called RISE. RISE is an acronym that talks about repairing harm to a family. It's very easy to incarcerate somebody for something horrible that they've done and throw away the key, but that is not a solution. Where, for example, that person who is the abuser is also the person that the older adult relies on for basic necessities of life. If that person is removed, who will then look after the older adult and provide those supports? So we are working with the University of Toronto. This is funded by the Public Health of Canada. It is a model that was developed in Maine in the United States, but it is extremely effective. And we started off with having, look for people that wanted to participate in the program. When you call 211, we will provide immediate support to the caller, but we will also, following an eligibility screening tool provided by the project designers, to help determine whether that individual might be a candidate for the RISE program. And the RISE program goes beyond just that hour call or hour and a half call. It now has advocates then connecting with the older adult that is experiencing abuse and walking them through what that family mediation process might be, helping restore those relationships and repair the harm that is happening. These relationships can be upwards of 18 months. So we're 2/3 into the funding for this project, and we're hoping that it can be funded yet again and be more scalable for not only Ontario, but across Canada. We have a 1-800 number, which you can use to reach us if you are beyond the borders of the Greater Toronto area. And that information will be provided at the last slide where all my contact information is. Again, I would encourage you to visit our website. We have a podcast going on, and tomorrow we have an actual webinar that is going to be talking about disclosures, about reporting, and what those ethical considerations are. So, as I mentioned, I bring a lot of slides because I like to share all this information with you. But I would invite you to subscribe to our newsletter, because there's a host of information on a monthly basis. It lets you know when our webinars are happening. And again, staff are accessible. I would like to say they're 9 to 5, but these my staff doesn't listen, and they work well beyond that 5 o'clock cutoff point. So we are here to support you, and if there's anything you need, please reach out. Thank you.
All right, thank you very much, Marta. And to what Marta was saying there, in that there was a lot more information in her presentation. So what my office is going to be doing for everyone is we're going to be sending off PDFs of all of these PowerPoints to all of the people who RSVP'd, along with a post-event survey and some other resources that some of our partners shared with us. So we will be able to make sure that you have all this valuable information. So thank you to all of our first 3 presenters. I'm going to ask them to stick around for a little while, because we are now going to have our first question and answer session, where you'll be able to ask questions of any of our first 3 panelists. I've been doing the PowerPoint, so I haven't been able to take a look at the chat to see if people are writing questions into the chat. And so we're going to welcome back and make sure we have the microphones off for Ken from Connected Canadians, Anne Marie from the Ontario Caregiver Association, and Marta from Elder Abuse Prevention Ontario. And here to act as moderator for our Q&A, please welcome the Director of Age Friendly Ottawa from the Council on Aging of Ottawa, Bonnie Schroeder.
Thank you, Sean. Pleasure to work with you again. I know we were at the summit last year. And just a round of applause for our 3 presenters in the first session, Ken, Anne Marie, and Marta. So there is a couple of questions I've got to get started. And this is from the Community Association. I think it's THCA, so I'm thinking that's Tanglewood.
Yes.
One of our satellites.
That would be Trend Arlington. If it's from
Trent
THCA.
Arlington. There you
THCA
go.
is Tanglewood.
Okay.
Oh,
And the question is for Marta, actually, and I'll jump in after. Is there a network, an elder abuse network in Ottawa?
Well, we have in the past worked with the Council on Aging, and we've had various entities around community-based senior serving organizations reaching out and expressing interest to want to start networks. As I mentioned, we were at one time almost at 60. Now we're slowly rebuilding that, but we are reaching out to some of our agencies or networks that were active in the past, and seeing if we can reinvigorate those as well. In some instances, we amalgamated so that we again can leverage resources and manpower. So we're hoping to help with that resurgence as well. And again, kind of the undertone of all this is there's very little political will to support this infrastructure, and yet it is a crucial part of every community. So we continue to, on an annual basis, advocate to have at least a part-time paid coordinator for each of the networks, so that we can have that consistency and legacy of information.
Yes. And I will comment that we've had a meeting with Marta as well as Brad with NROC, with a couple of other community partners about energizing the Elder Abuse Network. And the Council on Aging has identified elder abuse under our ageism and home and community care agenda. So thank you very much, Marta. Just to confirm the 3 ways that you can ask questions: you can drop them in the chat, you can message me directly through the chat, or you can put your hand up. I'm going to jump to a question to Ken, and it's one of the questions I've have, and I think an opportunity to connect the 3 presentations. So Ken, why is it important to be connected as part of elder abuse prevention?
Well, I mean, I think that there's so much that using technology can open up for older adults, and a lot of, the way that society is moving is making, forcing a lot of people to adopt technologies that they hadn't previously had to. But with that, there comes a lot of risk for elder abuse because of the fact that there are so many bad actors out there kind of trying to take advantage of people who aren't as experienced with using technology. So that's why we think it's really important for people to know that they have a free resource available to them. If they're worried that something might not be legitimate or that someone is trying to take advantage of, either their lack of technical knowledge or their perceived lack of technical knowledge. And we're that resource they can come to, or one of the resources they can come to from a technology perspective to help them build their confidence so that they can access these technologies confidently and use them to enhance their quality of life without as much of that fear. And that's our whole goal, is to make sure we can build up that confidence.
Thank you, Ken. Always a pleasure to hear about your service. So Anne Marie, a similar question. As you know, many caregivers often find themselves in very stressful situations where they may be the abusers and potentially supporting someone who they had been abused with a history of abuse. So what can we do to support and protect caregivers in those situations?
So I think similar to what Ken was saying, it's and the reason I pointed out, building that circle of support is it like the three things that caregivers tell us that they need the most are respite care, healthcare, or financial support, and the last one is somebody to talk to. So, and that's a call that OCO has responded to that's one of our most popular programs, is our support groups and our one-to-one peer support. Just somebody to talk to that somebody that isn't going to judge and has also been in those shoes or is currently. All of our peer support mentors and group leaders are all have that caregiving experience. They know how stressful it can be. They can relate, and that's a very tangible way that we can support caregivers to help lower their stress levels, and hope, and maybe even get some tips and people sharing ideas on how to manage things in a more balanced, safe way for everybody. So that connection is really important. Connection to other caregivers, connection to supports like we have a coaching program. You can connect with a coach to help you work through some more challenging situations. We have counseling support as well. Again, the whole mental health piece, that's the biggest impact is on caregivers, is their mental well-being. So that's what we respond to primarily, connecting.
See a lot of shaking heads. I know I'm shaking heads, and I think that links to the RISE research that Marta had talked about, that many caregivers, are the ones that are providing this necessities, and how do we maintain those relationships when individuals find themselves in an abusive relationship. Now I'm not seeing any other questions, so going once, and there's Anna Maria out of the block. We will have you share your question, and I think this will be our last question because I know we want to move into the second session. So Anna Maria.
Thank you, Bunny. Thank you, Marta, for the excellent presentation. I just want to let everybody, because it's a kind of a question and also a comment. I was very impressed, Marta, you make a comment on power imbalance, and I wrote on the challenge, control, authority, intimidation, and even punishment. Because elder abuse is not only between family and friends, but also I see that in relations. I work as a volunteer here in Ottawa, and I manage one organization for seniors, and I have been involved with seniors for many, many years, over 25 years now. And I see holding back information for seniors is a kind of abuse, elder abuse. Some maybe assume that because we are older, we are not able to discern information. To me, sharing information, asking for documents to share with my seniors is very important, not only to keep them informed, it also helps. We talk about Alzheimer's and how seniors are losing their mental abilities. And to me, keep them informed and encouraging them to read is a way to keep their mental neurons, the neurons working. So when you ask for these documents, the response isn't not sharing their documents, but make decisions that intimidate you. Like, for example, like for something, well, I'm going to give you a T4. That's not right. You know, it's younger individuals that are in position of power with seniors and trying to make us that we cannot ask questions, we cannot ask for documents to be shared. Why not? You know, information is knowledge and it's keeping us alert. And is the other used as a way to keep the senior silent and not ask questions? And yes, sir, yes, madam. I am not for that because perhaps our bodies physically, I cannot compete with the 30 years old or 40 years are running, but my mental ability is very good. And I try to encourage my seniors or the seniors across the city to be informed, to read, so they keep the mental ability fast and engaged and healthy. Thank you.
Yeah, I saw a lot of shaking heads across the guest speakers. So just another thank you and a round of applause to Marta and Anne-Marie and Ken for the presentation. And I'll hand it back over to you, Sean, for the second half.
All right. Thank you very much, Bonnie. So, hey, everybody. I hope that you have all enjoyed and you're getting a lot out of our event so far. Thank you again to Marta, Anne-Marie, and Ken. The three of you are more than welcome to stick around, but I'm sure you might also have to go back to your important work. So if you do, if you are leaving, bye-bye and thank you very much. So we are definitely going to now kick off the second half of today's seminar. We have our next speaker and then two more presentations and then a final round of questions. So we are very pleased to have as our special guest speaker an Ottawa writer who is also the co-author of Elder Abuse, You Have a Role to Play. Please welcome Savvy Duffy.
Hi, I see some very familiar faces. So everyone can hear me? Yes? Okay. So I'm going to start. A lot of the information that I'm going to actually share with you has already been covered in the first session. But can we go to the next slide and then we'll next and then the next one? Perfect. Okay. I want to tell you the story as to why John and I wrote this book. So my history is that I'm a lawyer and I ended up into the world of housing for older individuals. So we built and designed retirement homes. John is a lawyer and he looked after individuals in terms of drafting wills and issues concerning estates. I decided to exit and semi-retire so that I could be there for my children, because one of the biggest advice that I was given by my residents is that kids grow up. So spend as much time as you can with them. And John had retired. So we were so excited to kind of like give some volunteer time back and to share with everyone about, you know what, when you get older, it's the most beautiful thing. You can embrace life. There's so much that you can do, and there's so much that you can give back. We still have a purpose, if not a more valuable purpose. But one of the things that John and I discovered is that we were shocked, I think, to see how much elder abuse was actually happening in the community. And I've spent 25 years working with older individuals, directly with them and understanding. and so had John. And then we said, you know what? No one's really listening to us. You know, we go to the governments, we do this, no one's listening. Let's put a book together so that we share stories. If you share a story about what experiences you are going through, you are no longer alone, and it empowers you. So this particular slide, embrace a positive mindset towards preventing elder abuse. Like that's, if there's any message that I give, or and if this is the only slide I show, this is the key message that I would like to share. Elder abuse, it's regarded as a taboo topic. It's shrouded in stigma and shame. So the aim is to raise awareness. And you've got these amazing organizations that just spoke earlier, and you're going to hear from the police right after myself. Is we need to raise awareness. We just had one individual speak. Well, we just had, I think it was Anna Marie, who just said, knowledge is power. Knowledge is power. You have the power. Don't give it away. Do not give it away. Do not give your voice away. So the aim is to raise awareness about elder abuse, encourage a proactive attitude towards reporting it, and to seek help when it's witnessed. So we'll go to the next slide. We already had Marta talk about the definition of elder abuse, but I would like to repeat it. It could be a single act or a repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust which causes harm or distress to an older person. We'll go next slide. We already talked about this. The Elder Abuse Prevention of Ontario talked about that our population is growing. As we get older, you know, we have more people that are over the age of 65 than under. But I would like to stress one thing. I see elder abuse as a public health issue. If we see it as a public health issue, then maybe other people will have, maybe it will open up their frame of reference and, oh, wow, maybe we do need to do something about it. The other statement that I would like to add into this is that, as you can see, I'm from an Asian community. Elder abuse impacts all cultures. Impacts all cultures. So we'll go to the next slide. There's 5 different types of abuse. We had mention of most of them, but nobody talked about sexual abuse. But there's financial abuse, there's physical, there's neglect, there's psychological, and yes, there is sexual abuse. Just because you get older doesn't mean that we are free from that. Well, next slide. I'm just going to quickly run through these. In order to prevent, you need to know the warning signs of financial abuse. So pretty much, you're going to hear about scams and frauds in a moment, but misuse of powers of attorney, taking funds from your bank account, forging signatures, asking the older person to provide monetary support when failing to take responsibility for yourself, buying stuff on, you know, grandma's credit card when you should be using your own. We'll go to the next slide. I'm actually really good at talking fast. This is brilliant. Thank you. Physical abuse, unexplained bruises to the older person, broken bones or unexplained injuries, marks on wrists, rough handling. But this is what I would like you to leave on this particular slide, slide is I want you to start asking the question, why? If you see somebody like, you know, hiding their face or looking, ask the question why in your mind, and then start a conversation. Start a conversation. The next slide. Neglect, withholding physical, nutritional, and emotional and social care. When the home is not well kept, when basic tools of hygiene are not provided, this stuff happens. The most powerful one and the most painful one is withdrawing or over-medicating. So the next slide. psychological abuse. We as human beings, we have our mind, our body, and our spirit and our soul. When people take away our mind and take away our self-esteem, it's heartbreaking. And they do it in some little ways. You don't, with psychological abuse, you don't even know it starts to creep up. It's little things like not being invited to social events, always being spoken down to by a family member, told they can do nothing, they know nothing. It creeps up slowly. Next, we'll go to the next slide. Sexual abuse. Sexual abuse does exist where an older person is involved. So sexual abuse is where the older person is forced, threatened, or involved in sexual activity where no consent is provided, or where the older person is sexually taken advantage of, where the older person is incapable of giving consent. We'll go next slide. So who is the abuser? More research is coming out, but 91% of reported cases, it was actually a spouse, family member, friend, neighbor, or acquaintance that caused the abuse. Next slide. Who is more at risk of being abused and the abuser? We heard from the caregivers. If you are providing support and if there's a lot of stress, you're creating an environment for abuse to exist. If there's family conflict, if there's substance abuse, if someone is financially dependent on the older person. The older person is more likely to be abusive. There's physical or mental concerns, social isolation. If they've been subject to abuse earlier in life, we just heard the Elder Abuse Prevention Ontario talk about women. If we go back 20 or 30 years ago, a lot of women, so well, not a lot, but there was more abuse for women. It doesn't change when they get older, or it changes and the woman becomes the abuser. So there's concerns like that too. We'll go to the next slide. Statistics reveal that 7 out of 10 instances of abuse go unreported. They're not reported. If they're not reported, how are we going to make a difference? And why? Why do people hesitate next slide, to report abuse? Again, we're talking about fear, shame, embarrassment, and they're scared, you know? And also, what if you're dependent on the person that's providing, who is the abuser and providing the care? That's why the RISE program, the RISE research is really important. We need to bring awareness to elder abuse, but we also need to learn how to move through this and rebuild. We can rebuild. Next step. Next slide, sorry. To understand elder abuse, it's crucial to explore the underlying reasons. We already talked about ageism earlier. So as long as we have negative attitudes towards, next slide. As long as we have negative attitudes towards and stereotypes towards older people, we're creating a seed for elder abuse. So one of my most powerful influences in my life is Nelson Mandela. Nelson Mandela always talked about seed. When there's a seed that's already planted, and then when you keep nurturing it, even if it is a negative seed, it's going to grow. But if you can unplug the seed, it's amazing what can happen. So I'm just going to talk about some seeds. Number one, negative attitude towards older people. Next slide. Social isolation and feeling loneliness, which can lead to vulnerability. If you feel vulnerable, you're increasing the risk of elder abuse. Next one. Keeping the generations separated. If you keep generations separated, what you're doing is you're creating a situation of like the grass is greener on the other side or it's not. No one's talking. Next section, next slide. The other seed that I want to talk to you about is bullying. We had Brad talk about child abuse, and then you know, about young kids. You know what? Bullying does exist with respects to older individuals. It's a seed. Bullying can lead to elder abuse. We need to use more love and compassion. Next one. Institutional abuse does exist. So we talked about this in retirement homes and long-term care. There's 3 types. There's resident to resident, there's worker to resident, and then the visitor to resident. Next slide. Okay. So what can we do? What can you do? What can we all do? Number 1, embrace the beautiful gift of aging. Don't allow anyone to diminish that brilliance. Empower yourself. If you or someone you know is facing any type of abuse, please seek help. We've got access to the police, the friends, neighbors, the community. Sean, honestly, I'm sending you a great big hug for doing this event. Thank you. It's important to discuss elder abuse, which is what we're doing today. The more we converse about it, the stronger we become. And today you're going to receive some information from the police about how to combat frauds and scams. So that's a really key. And then the other thing is all the information that you're learning today, share it with your loved ones, share it with your friends, share it with your children, share it with your grandchildren. It's amazing how the trickle effect will grow. Remember, we talked about the seed. Let's nurture a positive seed to raise awareness for elder abuse and to say no. Next slide. We talked about mandatory reporting in retirement homes and long-term care. The reason why we have, why we know there's more elder abuse happening in retirement homes and long-term care is because there's mandatory reporting. It's not the same out in the community. And we already found out that only 7% of the population live in retirement homes. We need to extend, reporting throughout the community. So I have just a few ideas. So, well, John and I do. So we'll go to the next slide. Bridge the gap between different generations. We need to promote a more intergenerational community where different generations can have fun and support each other. Next slide. We need to nurture and promote your social health. It's really important for you to look after your own health and nurture it, physical, mental, but also social. Because you will be surprised when you'll be having a nice cup of tea and one of your friends may suddenly not be talking, and then suddenly you can say, what's happening here? It's a way for you to detect, and it's a way for you to empower yourselves. And the next slide. Okay, so your role in addressing elder abuse is crucial. By asking questions and being aware of the mistreatment of the older person, we can all make a difference. Each and every one of you can make a difference to saying no to elder abuse. So start and keep the conversation on elder abuse moving. And that's me. I'm done. Thank you.
Thank you, Savvy. And I hope you took note. Savvy's book was there on the first slide, but she and her co-writer are the author of a book that I'm sure a lot of you will be interested in, and the book is called Elder Abuse, You Have a Role to Play. You can find it pretty easily online. I got a copy of it myself. Okay, so thank you very much. We're going to move to our next presentation. Our next presentation is from Ottawa Police Services, who, as I'm sure you're aware, are frequently on the front line of dealing with cases of elder abuse here in Ottawa. We have 2 members of Ottawa Police Services joining us today. They will both take part when we get to our next Q&A, but we're going to start off with a presentation from one of those members. So please welcome, from the Ottawa Police Services Elder Abuse Unit, Sergeant Isabel Willett.
Hi, can you guys hear me? Good. Just to clarify, I'm not a sergeant yet. My name is, you gave me a promotion, thank you. I am Detective Isabelle Willette. I work in the Elder Abuse Unit at the Ottawa Police Service. I began my career in 1997. I spent some time on the road doing the 911 responses, worked in schools, and then graduated to investigations, the general investigation, organized fraud investigations. And for the last 6.5 years, I've been working in the Elder Abuse Unit. And it's been quite a passion for me. The complement of our unit, it's a small unit. It was created in 2005 out of foreseeing a need for the community. Back then, it was a sergeant and 2 investigators. And in 2025, it is still a sergeant and 2 investigators. So Sergeant Rennick, Matt Rennick, is at the forefront of running the unit. I am the senior member in this unit, and right now we have, I am by myself. I've been in retirement, but Detective Archibald, Carrie Archibald, may be joining us in the near future. She's presently on a temporary assignment. At the end, I will give you guys our information, how to reach us. And I think that it was discussed with Megan that she would be sending all the attendees our information. Well, the mandate of our unit is to investigate all crimes, physical, sexual, financial, against persons 65 years or older, or 18 years and older, who are considered vulnerable, whether that is cognitively or physically. Since we don't just serve the Elder Abuse Unit, it's been pressing on me to want to change the name of our unit, and it's presently in the works where we might be changing the name to Elder and Vulnerable Adult Investigations Unit. So I hope that takes place so that everybody can know that we don't just represent older adults, but also young adults who are facing challenges. And we are there for them too. So hopefully that will coming up soon. An important distinction to be made for any investigation to land in my unit is that there has to be a relationship of either trust or dependency between the abuser and the victim. To give you an example, if an elderly person or an older adult is walking on the street and they are randomly attacked by an unknown person, that would not make it to my unit. That would go to general investigations. What makes it to the Elder Abuse Unit is more typically where you have caregivers versus resident or power of attorney, just that codependency trust, where they usually know each other in some capacity. And it's not just a random event with a stranger and a victim. We typically don't do domestic elder abuse. That we have a specialized unit for that does strictly domestic violence, and they encompass all ages. And so that's the only portfolio that we don't carry. But like I said, we do the financial, physical, sexual. The criminal code does not define, there's no charges for psychological or verbal abuse. However, it can kind of look like intimidation, harassment, and where it eventually, if it's continuous, can look more like those two criminal offenses. So examples of financial abuse that we see a lot in our unit is in financial abuse is theft by person holding power of attorney. That basically is often between the victim and a family member who they entrusted in taking care of their affairs and taking care of their care. And next thing you know, the attorney holding the power over the property is making bad decisions and benefiting from the money of the person they were supposed to be taking care of. And so we see that a lot. Typically, the abusers are either family or friends. We also see predatory behaviors, predatory marriages, and as well as just elderly adults or older adults who are living alone in community will try to find resources sometimes to help out with whether it's, cooking or cleaning. And then they, will find those individuals on social media, whether it's Kijiji or someone that works in their building, and then their relationship is created. And eventually there can be, unfortunately, some targeting and some abuse where they basically gain the confidence and the trust of the elderly person and then engage in cruel activity by swindling them of their money. And so that is something that we investigate a lot as well. Theft, fraud, extortion, forgery, and false pretenses are all criminal offenses that we deal with on the regular basis in our unit. In terms of physical abuse, the charges that we are typically laying are assault with a weapon, aggravated assault, and fail to provide necessaries of life. To echo what was already said, most of our reports do come from long-term care and retirement facilities because there is mandatory report, because there are more eyes on the people that are in those organizations or are in those places of living, rather than being isolated in community where really you are often find alone in your abuser. And so a lot of our calls will come, from the LTC's mandatory reporting or like I said, retirement, and often it will be victim and caregiver issues. We attribute that oftentimes to either fatigue of the worker, a lot of lack of training, which lead to bad decisions. And sometimes they'll end up in a struggle that was unnecessary. The pressure also of having to get the job done in such little time makes it that the workers don't necessarily wait and return because they have a load to do and they just kind of keep going and they force the treatment or the care, which often leads to criminal offenses of assault, unfortunately. There is also a sexual assault. It's self-explanatory, and Sabby spoke a little bit about that. A lot of our reporting, again, not so much in community, but more into long-term care and retirement residences. And our reports kind of look often like if there was a shower given and perhaps, the victim didn't like the way the shower occurred, lingering too long in an area, or while giving pericare. So these are the types of incidents that we see coming in for us in terms of sexual assaults. Yeah, that's about it in terms of sexual assault. I would say that rarely do we get, stranger in the middle of the night attending. It's not that we see. It's a little bit more of what I explained related to a context of care. Oftentimes the way that it is reported to us, and we allow this because we are dealing with a more vulnerable demographic where sometimes they are not able to call for themselves. And so we accept third-party reporting for that reason. And it's why it's important that the community is engaged and is aware and alert and doing the right thing when it matters, because oftentimes, you know, they are not in the capacity to make that phone call or to address what is going on. And that can be for several reasons. You know, it can be because lack of being physically not able to do that. You know, a lot of them are not even capable to hold a phone in their hands or even move their limbs. So they are much more, you know, alienated or isolated rather. And so all that needs to be, you know, taken into consideration. Because we don't have a governing body, an authority that really looks after our older adults in our vulnerable community, just like CAS, you know, is there for the vulnerable children. We don't have that for our older adults and vulnerable adults. And that means that we really have no choice but to work constantly with our partners. It's the only way that we can do our work, because nobody comes in and takes them to a safe place. It doesn't work like that. And it's unfortunate because it's a great need. Oftentimes the hospitals end up being the dumping ground of, you know, no one really has that role. And so we do work with our partners, and as much as privacy and sharing private information is such a big issue, you know, everybody is on the same side, and we are all working for the main goal of making sure that our clients are safe. So for do my job, I have to work closely with my partners, such as Ontario Public Guardian and Trustee, hospital social workers, Care for, Home and Community Care Services, Ottawa Housing, Service Coordination, Development Service Ontario, and the Ministry of Long-Term Care. So altogether, we've been able to take care of some really serious files where we absolutely needed to work together to bridge the gaps because between me and the next resource, there's a huge hole there and no one's covering that. So everybody has to overextend a little bit to make it work. When people call us, whether it's a third party or a victim themselves, yes, we do always want to respect the wishes of the victim. It is very important. However, if the victim is not able or capable of understanding what has happened to them, we do work in a public interest frame of work. And so if we have someone that works in the community or in long-term care who has committed an assault on a person, a victim, it's very difficult to not proceed with those charges because that worker will go and take care of hundreds of other people. And so when we found that criminality has occurred in that setting, we always try to explain why it is best that criminal charges are laid. But we do have other options and alternatives to criminal charges. We have, warnings. We have alternative measures. That is a judicial measure as well, but it offers less protection as a whole for the community if we go those routes. So in my line of work, when a criminal offense has occurred, to protect the community, it is best that criminal charges are laid, but hopefully with the support of the victim. People can report to us in many ways. They can call us to make their report. at extension 7300. The number is 613-236-1222, and the extension is 7300. And sometimes the line may be really, really busy, but that's okay. You can leave a message and they will call you back. It's important to know when the police calls the community that it shows that it's an anonymous phone caller or unknown ID. So don't be surprised if you see that when the police calls, that's what you see. You don't see Ottawa Police. They can also do their report online, depending on the occurrence, at ottawapolice.ca. If it's something that is occurring at the moment and in development that requires an attendance, then it's best to call 911 or our non-emergency line at 6211. I'll repeat those numbers after. But if you're not sure of what's going on and you feel unsafe, it's really just important that you just call 911 and everything can be figured out after. We also have an elder abuse information line at 613-236-1222, extension 2400. And you can just call that number and speak to a civilian who has all the information about anything that you might have regarding elder abuse. You can also call me, the investigators, but myself, at 613-236-1222. It's all the same number. The extensions are different. So for myself, it's 5436. For Detective Archibald, it's 5418. And for the sergeant, is 5162. People will call us sometimes, whether it's me or my partners or the elder abuse line, just to get advice. Even if something is going on, they just want to get advice. What should they do? What can they do? And we are happy to just speak with them, have a consultation, and then give them what we think, what is available to them and what, how can we help, and the options that are available to them to go forward in whatever it is that's going on. We also have a victim support services, and it's a group of a worker that works with the Ottawa Police, and they provide all kinds of resources, not only in elder abuse, but for every other victim, whether it's in every section. It's applicable to every section. And so they are a wealth of information in regards to resources. So that's really what we do in a nutshell. I think, are we doing questions at the Q&A? Perfect. All right, so that's me. Thank you.
All right. Merci beaucoup. Thank you, Detective
Merci.
So, yes, that brings us to our final presentation for the afternoon. Before we get to our last Q&A, is from the Canadian Anti-Fraud Center for a presentation on how seniors are vulnerable to fraud. Please welcome Keith Ward. Hello, Keith.
Hey guys, thank you very much. I'm gonna they've tucked me away in a closet here to do the presentation, and I've got a face for radio, so I'm gonna stay off camera. But if you have any questions, feel free to ask away. So quick presentation about elder abuse and awareness. If you want to go to the first or the next slide, rather. Just a quick overview. I know we're short on time, so I'm going to touch on fraud, quick intro of who we are, what you're going to see that targets seniors to this date, and the trends that are it, how you can be vulnerable, how you can protect yourself, the reality of what's out there, and then just like I said, proactive and reactive ways to limit fraud. So just as a quick disclaimer, like stats for us are forever changing. We have intake units that review reports daily, and for that reason, numbers can change by the day. So just keep that in mind as this presentation goes through. So the Canadian Anti-Fraud Center, we are based out of North Bay, Ontario. We are the central repository for all things mass marketing fraud for Canada. If you have a cyber-related incident, it would go to NC3. But for the most part, especially for scams that are hitting seniors, those reports would come through us. We are broken down into 3 groups. So we're the RCMP, the Ontario Provincial Police, and the Competition Bureau of Canada. And if you want to go to the next one. So within the CFC, there's 3 components. There's the fraud intake unit, which are call takers that review reports that come in through our online toll-free phone number. A handful of years back, we started allowing online reporting, so you can go on and make a report. These call takers that work in the fraud intake will go through them and make sure that they're validated, that the proper information is inputted. Sometimes it can get confusing. You can add yourself as a suspect. You can put the information in incorrectly, or you might just be kind of looking for answers. So we'll clean it up and look at it. The one thing that stands out by the CFC, we have a fraud awareness, a senior support unit, which is a group of volunteers, all senior and some students that come in, and with seniors being the most vulnerable demographic to date, these individuals will contact seniors proactively and give them heads up on new trends that are out there. A lot of these seniors that fall for scams and end up losing money, quote unquote, they're added to a suckers list. And so what that means is that scammers know that these are vulnerable seniors and that they're likely to fall victim again. So they will specifically target these seniors in other attacks. So whether, let's say, for example, you give up access to your computer for the Microsoft scam, you think your computer's infected, someone's willing to help you out, they sign online, they drain your bank accounts as you think that they're trying to actually get rid of all the viruses. Seniors are educated, and anyone is educated to take certain steps to protect yourself. What scammers are going to do, and they're always one step ahead of us, is they're going to call back and they're going to say, oh, we can help you get your money back, or you've been identified as a victim, we've recouped money. If you want to retain a lawyer, we can help you to send us money again, or let us get back on your. So it's just things like that everyone can fall victim to, but seniors especially, so that this senior support program will proactively call out and make sure that they're aware of what's next. And then the operational support units where I work, we do disruption programs. So we limit fraud by shutting down emails and phone numbers, websites, merchant accounts, credit cards, and so on. We also work with international police, so Europol, Interpol. We have requests that come through to us, and we have LOs across the world that we can then push out fan outs and educational pamphlets and that to reduce fraud. And then next slide. So excuse me. It says this was a study that was done with McMaster years back. They found a boiler room. They went through the list of all the victims. They cross-referenced it with police portals to see who had reported to police. And it was found that only 5% of actual victims knew to contact police. And that could vary for various reasons. They may not know that they're a victim of fraud. Seniors specifically, they may not want to lose power of attorney. They don't want to let family know that they're losing these funds and reporting it, so they're going to keep it hush. They may not be educated on who to contact, what to do. So it's estimated only 5% to 10% of people are reporting fraud. And then just to give you an idea, we took 2024 since it's the full year in the books. We had 108,000 reports that came through, which had $639 million in losses. And to give you an idea, there's over $500 million in losses, and only 5% of people are reporting in Canada. If you go to the next one. So these are the trends from last year, and this is for the general public. It's male, female, ages 0 to 100. The most reports we get is an identity fraud for various reasons. You get a hack on the computer or your database breach, you forget your wallet, you fall for a phishing scam, you hand out personal information. So there's no actual dollar loss because it can all go through identity fraud. Service scams, the one I touched on, that kind of speaks of your computer might be needing updating, or you're eligible for this plan or softwares. And then investments, you can see, although it's not the #1 reported scam to us, it is the #1 reported scam based on dollar loss, where last year we had $310 million in losses based on investment. And I'll touch on a little bit more. There's a new thing coming out, and they're calling it pig butchering. CFC is trying to get away from that word, because essentially what pig butchering is, it's a romance scam, you fall in love with someone, and the concept of pig butchering is the scammers are trying to beef up this pig to make it blow up, and then they're going to drain it for all the money that it's worth. And so what we've considered it is as a relationship scam, but it starts off as a romance. You think you're falling in love with this individual. You want to build the future together. What better way to build the future than invest money and have the finances available to travel the world and buy this perfect house and retirement and that. And then eventually, so these love relationships turn financial. You invest all this money, and then the investment's a hoax. And when you go to pull out your funds, you realize that you're on a fake platform. There is no money, and the scammers have kind of drained you dry. So those are the stats for all of 2024. If you go to the next one, I think I touch on, we'll skip this one. We'll go to the next one. These are the ones that are specifically to seniors. So for investment fraud, we had $111 million in losses just to seniors last year. Romance is the same one. So investment is strictly investing where you go on a platform, you think you're investing in Bitcoin or coin, whatever platform you're using. Romance scam is kind of where it starts as a romance and it goes into an investment. And then, like I said, you kind of work your way. Bank investigators starting to climb, where you'll get a call, it'll say it's your bank. We've realized there's transactions that aren't authorized. Can you validate? Did you spend $3,000 on Amazon last night? No, it wasn't me. Just give me your credit card number and your banking information. I'll go in and I'll reverse the funds for you. And of course, when they get access to that, they just go in and they do the opposite. They drain it dry again. Next one. Vulnerabilities to seniors. So why are seniors being targeted? They're more likely in the demographic, they're more likely to be retired, where now they've got the free time, they've got pension, access to funds. They're more likely to have assets that are paid off, your mortgage, your car, your loans. They have ready cash available. Seniors, through interviews that we've done with seniors in the past, they're a bit more lonely. They enjoy the communication or the one-on-ones that you might get with a scammer, and if it costs you a little bit of money, at the end of the day, some seniors report that they appreciate the fact that they have someone to speak to and something to invest their time into. And then just the lack of awareness and all these new trends that are constantly changing. Everything now is kind of leaning its way into cryptocurrency and Bitcoin and that. And I mean, with all the training I've done, it's still miles above my head. I can't grasp it, and even though I'm trying my best, and I could see how it can get lost and confused, and especially if someone else is just doing it all for you in the back end and you're just seeing money get pulled from your bank accounts. And then the reality of it today is that no matter who you are, everyone is going to be at one point targeted for scams. Scammers find any way that they can to find vulnerabilities in people and take money or take assets or put liens on your house so that they can borrow money against you and so on. A big one right now that we're seeing with seniors is that these home renos, you get a new furnace, you can get hot water tanks and so on. It's legitimate in the sense that someone comes and they install it in your home. You sign a contract for it, but in the fine print of the contract, it says the rental of this will be paid over the next 25 years and it will be paid at such and such a rate that's beyond anyone's means of doing. Failure to do so can put your house on a lien or make you subject of payments. And then at the end of the day, these seniors have this hot water tank that's now cost them $80,000 and they can't keep up with these payments. And now they're going to have to remortgage or lose their house. So there's a program in the UK that's called Take 5. And what it is it's just 5 minutes in the day. Speak to someone for 5 minutes and mention fraud, what you know about it. There's information that you have that others don't, and vice versa. Other people know might be resources or information or victims that may need help, and that just the dialogue between other people can go a long ways in helping combat fraud and reduce victimization. And so how to protect yourself, obviously education. If you are a victim of fraud, contact your local police. The CFC, we do, like I said, we're a central repository for all of Canada. We don't specifically investigate. We pass it off to these investigative agencies. We conduct disruptions. So if you, let's say you, as a senior, you're getting constant phone calls, nuisance calls or emails and that, we have the ability to shut those phone numbers down, close bank accounts, or put bank accounts on hold and freeze them, I should say, close email accounts and so on. There are, if you go to our website, the Canadian Anti-Fraud Center.ca, you can see proactive tools and means of what to do, what to expect, what a fraud might look like. And if you are a victim, you can obviously report online, or you can call our toll-free phone number. And yeah, and obviously we want to direct everyone who is a victim to go to your local police and file there, because they're the ones that are going to have the means to investigate for you on your behalf. And then go ahead, you can skip that one. Just has our toll-free number at the bottom there.
Oh, sorry. Sorry, Keith, I think I skipped over your toll-free number, but like I said, I will be sending all of this information out to all of our guests. Anyways, hey, so thank you, Keith, and thank you to Isabel and Sadie as well. And of course, please do stick around. We are at 3 o'clock, but we're going to try to still hold to our next Q&A segment. And we are going to add one more special guest here today for the Q&A from the Ottawa Police. I hope he's still around, but please welcome Community Liaison Sergeant John Drader. Thank you for being with us here today, John. So once again, to lead this Q&A, please welcome back from the Council on Aging of Ottawa, Bonnie Schroeder.
I thank you very much, Sean. Uplifting in the first part, you know, seeing good practical support in this one, definitely knowing that there are agencies there. Thanks, Seba, for bringing to light some of the issues. I did drop your book on Indigo by Canadian in the chat. And then Detective Willette and Keith from the Anti-Fraud, all very good information, knowing that they're there to support you, but some of the numbers are quite startling. And my question that I saw come through, there were a few. One question for Detective Willette. I had a question about home takeovers. Is that a growing concern for older adults? People, again, building relationships of trust and then moving into their home and then taking it over.
Yeah, so that would not be something that my unit investigates. However, I am working in the physically, I am working in the organized fraud unit, and I don't think that we have that many in our jurisdiction at the moment.
You had mentioned kind of that hole between your service and getting some help with older adults in the situation. Are you aware of any jurisdictions in Canada or elsewhere where there is mandatory reporting for abuse of older adults? And the secondary question is, what would be required to make this happen in Ontario? And I'm not sure if you're the right person to ask that more policy, but was wondering, yeah, mandatory reporting in other jurisdictions, and how do we get it in Ontario?
I don't think that I know of that there in Canada that there is an authority. I would be very jealous if there was. What do we need to happen? I mean, it truly is at the federal government level. This is, like I had a case not that long ago where this was very such an issue, because I had a vulnerable adult who was like 27 years of age. Primary caregiver was the abuser, and it was like, okay, well, that person now needs 24/7 supervision, and where does that person go? And if failing of family members, who takes over that? Who arranges for that? Who makes this happen? It's me. and I don't have that I don't have that know-how. I don't have where, just know there's no agency that comes in and says, okay, we're going to safely put this person in this residence with there's just no. And so it's creativity and, overextending what we do to meet the next resources to make things happen. Round tables, having everybody sit at the table and make it happen. But it's difficult. And this is why our hospitals the hospitals become the dumping ground of that, because the only safe place at that point is a hospital. In failure of anything, of any other, emergency placements are very difficult to find. There are very little beds available in our city, especially for vulnerable adults with a lot of needs. And, they end up in a hospital, which is not a suitable setting,
Yes.
So yeah.
And we know people who are older adults who are in hospital do deteriorate quicker. So
Absolutely.
something like the elder abuse response and referral service that we used to have really did fill that gap. And again, the Elder Abuse Network of Ottawa is kind of coming together. So if there are interested parties wanting to be involved in that further discussion with Elder Abuse Prevention Ontario, the Council on Aging, and Brad over at Nepean Rideau Osgood Community Resource Center, by all means, be in touch, and Sean will share that information after the meeting. The one other question that came up through the chat directly to me, Keith, you're available here. There you are, pinned at the top. So you, wow, that's a lot of money being taken out of the hands of older adults that don't necessarily may have access to money, but not, who can afford that kind of money? That's significant. So what are some of the most common and pervasive online scams? And as these scams become more frequent and more sophisticated, what should people be looking out for? Double-barreled question there, Keith.
Yeah, no, it's a great question. So let's say specifically for seniors, some of the scams right now that I didn't touch on include the emergency scam, which is when grandma or grandpa get a phone call and the suspect says, "Hey, grandma, it's me." Grandma might drop the ball and say, "Oh, is that you, Keith?" And now the scammers know that grandson's name is Keith, and they'll say, "Yeah, it's me. I was in a car accident. I rear-ended someone. They've agreed not to sue me and I was on my cell phone texting and driving, whatever. They've agreed not to sue me if I cover the fees of the car repair. Can you send me $2,000?" Which we were seeing more and more, but what the new twist is right now is that scammers are then saying go to the bank and pull out $2,000 or whatever the dollar number is, and then they're actually going to the seniors' homes and knocking on the door and being handed the cash. So it goes to show the sophistication that someone knows the senior lives there. They've got the means of knowing that they have access to bank, like they can travel at their own will, that they have grandchildren, and that they're gonna pay up the money. So in those cases, obviously, if you ever get that phone call, you would contact your grandchild and just confirm with them. No police officer is going to accept the payout to drop charges of illegal activity. And so just to be mindful of that. And then the other big one that hits seniors, which goes beyond investments and romance, is the service scam. So it's the calls that you get to say, "Hey, let's fix your computer. Let's do some home renos for you. You can pay cash." It's shoddy work. It's these liens and these contracts that aren't they're not black and white. They're more gray because of this fine print that makes it deceptive. So just to be mindful of that stuff.
Yeah, so consumer protection, just around the bank, I had a recent experience where I was paying maybe for some services with some cash at a bank, and I got screened for abuse. Can you just share a little bit about the federal legislation that requires banks to do that additional screening and reporting on financial
Yeah, so I think the threshold set right now is and I mean, it's at 10 grand. So if you ever were to pull out 10,000 or more, you have to fill out it's like a small questionnaire that would be used for FinTrack, for suspicious transactions. But obviously at lower increments, if someone goes into the bank and they request $5,000 in hundreds, the tellers have the rights to ask. They don't need to ask, but we hand out pamphlets and documents to banks and retails to educate them. Canada Post is another example, and questions to ask to make sure that, do you know who this person is that you're giving money? Or are you aware that handing out money can make you a suspect? Like there's a chance that it doesn't come back. And so it's just an added step to hopefully help that victim realize that, hey, maybe this doesn't sound right, or maybe this is a scam and I shouldn't be going through with it, or doing my homework before I do anyways.
Yeah, well, I got scanned and assessed at a bank recently, and I was like, oh, thank you.
Yeah.
Told
Yeah, it's
them
good
who
to
I
know
work
that they're
for.
doing it. So for
Yeah.
sure.
Last question, Anna Maria. Let's go quickly.
Thank you. Well, it's not a question, it's a recent experience. It's with the credit card. I received my credit card. We know more or less how much is spent and where we expect to get the bill. So it was too high, and I was checking. I was able to see charges were done in American dollars, and immediately called the bank because I never did those transactions. They said that a couple were in physical. I mean, that I was in the store. I was not in New York or Colorado, so I complained. But my question, I'm still very intrigued because the issues were resolved, the first one with less than 24 hours and the other with 72 hours. But my question and my greatest concern, the card was changed, okay, is that these crooks, criminals, got my email. So I never, and I accused the credit card company that they were the ones to provide the emails to these crooks, because I guess to get my charges reversed, they have to talk to them. So to me, it seems that there is an inside work. That's my suspicion. The last call, they said, well, but your problem has been solved. It's not that my charges have been addressed. It's my concern that is a criminal activity between perhaps an employee and these crooks. So I am very worried that this could happen to other seniors. So how to proceed, where to complain, because I see that this credit card should be investigated. Who gave them the authority to share my email?
Yeah.
Thank you.
Definitely privacy. Thank you very much. There is a couple of further questions that are kind of a little more specific to specific situations. We've made note of them in the chat, and I'll pass it over to you, Sean, for some final words. Thank you very much for allowing me to moderate today's question and answers.
My pleasure. I think I'm going to try to quickly handle two of those questions. So somebody sent somebody sent a rather lengthy question about a case of fraud happening with a long-term care center. It seems like that is not the kind of question that we might be able to handle today, but it seems like there is certainly some possible legal dispute between long-term care owner residents and the center itself. We will take that question, whoever sent that in, we'll send it off to our panelists, and maybe somebody might be able to provide a response. But I did see quick questions. Why is there more fraud attributed to having a landline as opposed to a mobile phone? And Keith, correct me if I'm wrong, but I believe that is likely because a lot of people's mobile phone numbers are on do not call list, or are not as easily accessible as landline numbers. Keith, if I'm wrong, just jump in there. There was a question about Sabby Duffy's book. Where is that book available? Whether it's available at the Ottawa Public Library or at Chapters Indigo or Amazon. I know it's available on Amazon. That's where I got it. I wouldn't use it Amazon today for different reasons. Sabby, is your book available at the Ottawa Public Library?
I don't think so. I'm not sure, but that actually would be a good place for it to be.
Yes.
Well, I can look into that. I have some connections. And to the person who asked a question about landlines, we had a comment from Detective Willett. I do not believe having a landline makes you more vulnerable. There are several scams using cell phones. I have a cell phone. I get scam calls all the time. And in fact, Keith said landlines have additional threats compared to cell phones. The threats are everywhere, no matter what phone you're using. So what I'm going to do, for any other questions there, I believe we're able to keep a record of it and we will send them off to our experts. We are going to wrap up very in the next minute or two because we are certainly at time. Now, because our event went a bit late, my co-host Brad Spooner had to leave to get to a meeting, but he sent me a copy of his closing remarks, which I did want to read out to you because they were quite good. So I'm just going to read here. I've always felt that knowledge is power, and the more we know, the better we are able to make a positive impact in someone's life. Please take what you have learned today and share it with others, as I know I will. I have spent 15 years in a professional capacity supporting coalition work, networks, and providing leadership to frontline staff who were committed to the issue of elder abuse in Ottawa. The City of Ottawa's population is now slightly more than 1 million people, with a population of older adults making up 19 to 20% of that population. People over 65 years old, that is 200,000 individuals. To be clear, not all of these people are abused, but we also don't know the real number as so much abuse goes unreported. We simply need to get better at providing support for those who are victims of abuse. Let me be precise. We need to have a sustainable frontline response above and beyond the great support from the Ottawa Police Service. Let us work together to move the needle on making a difference. Thank you. So that was from Brad Spooner. Thank you very much for that. I want to thank all of the presenters and co-hosts who joined us today, including my partners at the Council of Aging in Ottawa and NROC. And I want to thank the community at large who participated here today. Clearly, there is a need for this kind of information to be shared because, unfortunately, there are gaps in our local system of elder abuse care here in Ottawa. Increasing awareness about elder abuse is certainly one way to combat it. So thank you for doing your bit to help increase community awareness. As I said, my office will absolutely try to send out an information package with all of the resources you saw here today to everyone who RSVP'd for our event. We're also going to be sending you a post-event survey so that you can let us know how today's event went, so that my office and I can continue working towards better engagement with residents across Ottawa. On behalf of everyone on my team, thank you very much for being here, and we will see you soon.
Thank you so much, Councillor Levine. Excellent. And
Thank
thank
you.
you. And thank you, Bonnie, too.
Excellent webinar.
Thank you, everyone.
Thank
Bye.
you. Bye-bye.